So I think we will go ahead and get started. It's 3 after now. We're going to try to mute you all, but just in case that doesn't work, you might want to keep yourself on mute as well until we get to the end and have time for questions. So let me fix my screen sharing, and then we can go ahead and get started. There we go. Okay. So I'm Lisa Miller, and I'm here. Actually, can someone please unmute themselves and confirm that they can hear me? Or chat in that they can hear you. Awesome. Thank you. Important to confirm that. Okay. I'm the Data Collaborative Manager with Comagine Health, and I'm joined today by Tori Scholl and Cindy McElhaney. You may know either or neither of them, but they're here to help answer questions and help run the webinar. So Tori is going to be monitoring the chat. If you have technical issues, please go ahead and chat those in. I'm going to save time at the end for questions about the portal and about the data that's in there. So you can either at the end speak verbally or chat your questions in. But I think just to make sure we get through the material, I do want to have you save questions for that end period. So great, thank you all for joining us. We're excited to be here today at our first webinar. We're recording this webinar, and it should be available after we finish up today, after we get a couple days to sort out where it's going to be and how it's going to be available. Today I'm going to provide a quick review of where the data comes from and what's in the portal, and then quickly move over to some new features, including women's health provider reporting, a couple of known data issues, some features in the portal that you may or may not be familiar with, how to maintain your provider roster, and then just some quick bullets about things coming up soon to look forward to, and then we will have that time for your questions. So we should have a good 10-15 minutes for questions at the end. So let me start here with a little bit of background about the data that's in the portal. Again, we're a voluntary claims, all-payer claims database for the state of Oregon. So we receive data from all the commercial payers based in Oregon, plus Oregon Health Authority provides Medicaid data, and CMS provides Medicare fee-for-service claims data. We aggregate all of those claims and provide them to you in the provider reporting portal. The benefit, of course, is that it allows you to see a report on all of your patients, regardless of their insurance type, in one place, rather than having separate reports from each individual insurer. It also enables comparisons between health plans and medical groups and providers, and because we are aggregated, we're able to track your patients over time as they move between different health plans. We have about 80% of the total Oregon population represented in our database. So in 2018, it was about 82% of the fully insured commercial population. We don't have the national payers represented in here. About 25% of the self-insured commercial population, 100% of Medicaid, and then overall 89% of Medicare, which gives us, again, an overall view of about 80% of Oregonians going back about 10 years. So the first feature that we wanted to share with you is a new addition last portal refresh, which was that we added OBGYNs to the provider directory. Previously, it was limited to primary care providers. Currently, we're reporting on women's health screening measures only for the OBGYNs, so breast cancer, cervical cancer, chlamydia, and effective contraceptive use. And now I'm going to flip over to the portal and give you a little demo of what that looks like. All right, so I'm showing you a demo site here with pseudonymized names, data. Everything in here is demo, so no need to worry about that. So the women's health providers, let's look first at our provider list here. So I'm going to, this actually is a useful tool that you may not know about. If you're somebody who has access to more than one organization, this is where you would change your view. So I'd like to view it as a medical group admin. right now. If I also had views of different clinics, that's where I would take a look at those. So the medical group view, let's look at my providers first. And I'm going to use my filter to look for just my OBGYNs. So now these are my OBGYNs in my medical group, and I can see who they are, what they're doing. Then if I look back at my measures, I can also filter my measures to see just measure results for the OBGYNs in my clinic. So you can see, again, those 4 measures that I mentioned. We've got age bands for some of them, so chlamydia screening and ECU have different age bands, but in general, really it's 4 different measures that we're looking at. And then we're able to see the results for the OBGYNs in my medical group. If I want to look at the PCPs again, I just flip back the affiliation type to PCP. The next thing I'd like to show you is a couple of known data issues. The first, it's not really a problem with the data at all. When we look at CPC Plus beneficiary attribution, CoMedgen Health and the CPC Plus program differ in how they attribute members and in how some of the measures are calculated. So the results are not going to exactly align with what you'll see in the CPC Plus data feedback tool. The resolution for that, CMS, of course, uses results from their data feedback tool to calculate practice payments for their beneficiaries. We're continuing to work with them to improve our attribution results, but there's a lot of factors that play into it in terms of how attribution is done that it's not likely to ever align perfectly, but we're continuing to work to get it as close as we can. The next data issue regards some Medicare Advantage data that's missing from MODA. We did not receive membership data from MODA for Medicare Advantage members for the first quarter of 2019. So many of those members were excluded from the measures, and others were reported as being Medicare fee-for-service members. It impacted all measures. It's already been corrected in the next round of data that's been submitted, so when we refresh the data in the portal again in April, those members will be included again. So I wanted to show you in the portal where you can see these known data issues. So I'm logged in here, and I'm going to click on the documentation section. Oh, shoot. Sorry. It's not working quite right. All right. Okay, so I'm clicked onto the documentation section, and this has useful resources for you to be able to explore some tutorials, some technical appendices. I'm looking at the known data issue log, though, and this is where we keep that document. I've opened it up already for us so that it wouldn't take time loading. This is what it looks like. So it just contains a description of each of the known data issues going back as far as the data that's in the portal. So this latest one, the Medicare Advantage from MODA, is listed right here. All right. Let's take a look at some comparison reports. So looking at some features that you may or may not already be using and maybe trying to maximize the way that you use them. So we'll take a look at comparison reports. First, I wanted to note for you that when we're comparing across reporting periods, in other words, looking at trends over time, you can either leave all reporting periods in there or you can choose which reporting periods you'd like. For now, I'm just going to leave it with all reporting periods. I'm going to select certain measures because I don't really want to see all of them. So I'm going to deselect all the measures that are listed and then pull down this drop-down menu for groups. Let's look at women's health measures, and then I'll select them all and click Done. And then I'd like to add in the Oregon Clinic average. I have the option of, if I'm part of a medical group, I can add in my medical group average, the Oregon Clinic average, the Oregon benchmark, which is the top performing clinics in the state of Oregon, and the national average. But let's add Oregon Clinic average. And then I have the option of looking at a specific health plan if I'd like to. I can look at a certain product type. And again, we have that affiliation type option if I just want to see the OBGYNs. But I'm going to leave it with all for now. So, I also was going to mention I have the option of adding providers if I would like to. So these are all the providers available at my clinic. I could select all of them, or I could just select a few of them. And then they would show up on these graphs as well, and I'd be able to compare their results. So now I'm able to see my organization's results compared to the statewide average on these women's screening measures. So one of the questions that came in ahead of time when we asked you to register for the webinar, one of the questions that came in was, how do we best utilize these available reports? So this is one way that you might want to take a look at the data to use it to point in the direction of where you might want to do quality improvement. So in this example, my organization's breast cancer screening rates are below the Oregon Clinic average. So I might want to take a look and see if that's something I want to try to focus on. Even if it had stayed consistently above the Oregon Clinic average, it's been very stable across time for me for the last couple of years. So that might be something I would want to look at anyway, if I wanted to try to improve that. Cervical cancer screening, I can see the same thing here. Chlamydia screening, my clinic is doing very well, higher than the Oregon state average. I wanted to point out, because you've probably seen this in your data, the measures where we have age bands, we only have the statewide average for the total age band. So as soon as we look at chlamydia screening in one of the age bands, the statewide average is no longer available. But this is still very useful for trending your own data. The next thing I wanted to show in here, you may not know that this is option for you, is to view this as a table. If I want to be able to export the data and work with it a little bit, I've already pulled this up so that it wouldn't have to process while we're on the webinar here, but this is what it looks like if you view it as a table, just by clicking on this button. So then I'm able to click on options and export this to Excel if I want to be able to work on it. I can also use this one, which flips the axes of this table, if that's a little bit more useful for me. And then in both cases, I have the option of printing it to PDF so that I can share these charts or use them elsewhere. So another way of using these reports that you may not be familiar with is, let's go to reports again, is looking at them by product type rather than by reporting period. So once this loads, I will show you what I mean. Okay. All right, there we go. All right. Now, I'm back in reports, and on my filter button, instead of comparing across reporting periods, I'm going to compare across product types. What this shows me is a comparison of my measures by product type. So again, let's take a look at the women's health screening measures. I'm going to select all of them. And I'm going to continue looking at all payers. And I'm looking at the current reporting period, which is April 2018 through March 2019. So what this shows me is among my breast cancer screening patients in the denominator, their results by product type. So I can see that my Medicaid fee-for-service screening rates are much lower than the other product types here. So that might be an area I want to take a look at doing a quality improvement project around, potentially. A question I would ask first, though, is how many people are we talking about in that group? And that's where I would probably want to take a look at the table to see what the number is. So now that I see that my Medicaid fee-for-service population for breast cancer screening is 4 patients, then I can make an informed decision. Is that an area where I want to try to do some quality improvement, or is it not? So the next thing I might question is, who are these patients? So I'm going to click on that numerator. I want to show you first this asterisk is an indicator of small denominator size, meaning the measure results may not be completely accurate. That's just something we note anytime the denominator gets less than 30. So when I click on this numerator, or result rather, I can see the individual patients who are in that measure. Again, this is pseudonymized, so don't worry about their gender for this breast cancer screening. When reconsiderations are open, you would see an option over here to request a reconsideration, and that means that you're requesting to tell us that our data is incorrect. So every 6 months, we open up a 65-day period during which practices have the option of telling us that they would like to correct some of the data that's in the portal for various reasons. In this case, it might be that I know this patient had breast cancer screening, so I would put in here this patient had it, here was the date. We don't require chart notes or any other documentation. It's an attestation style request for reconsideration. And then those would be accepted or denied, and then those changed new results are incorporated into the data before it's reported publicly on our Compare Your Care website. So another question that came in ahead of time was, how do we correct data that's not accurate? And that reconsideration process is the process for how we do that. So we do plan to have a webinar each quarter when we update the portal. So I'll go in more detail into how to do reconsiderations next time, because reconsiderations will actually be open next time. They're not right now. Okay, so the next question that we wanted to ask or wanted to look at was about the provider roster. So what I've done here is click on providers, and then I am able to see this banner that asks me to validate my roster. I'll note that this is only available if you're viewing from a clinic view. If you're viewing from a medical group view, this is not available to you unless you log in or view each clinic individually. So you're validating the roster for a clinic, not for an entire medical group. So if I've been staying on top of these and none of these have changed, then I can just click Validate Roster, and we will know that you have confirmed that those are correct. But let's say that we need to make a change to one of these folks. Let's say that Dominic actually has left the organization. So I'm going to click on his affiliated organizations, and then I can click on this line, and then I can see he started on 10/1/2019. If he's left, I could add in the date that he left the organization and just click Update. Then what will happen is that he will actually stay in my provider roster until we're no longer reporting. Say he left on 1/1/2020. He would stay in the provider roster until we were no longer reporting any dates through 1/1/2020. So in other words, once we started reporting March 2020, he would roll off my roster, but he would appear on the roster until then because he was still seeing patients during the time frame that we're looking at. So let's look at Chance as an example of that. Chance actually left in May of 2018. It is correct that he's still on my roster because he was still seeing patients in April and May of 2018. So next reporting period, he would drop off. Let's say that I need to add a new provider. On the provider bucket button here, I can click Options, New Provider. I think the internet is slower on this side of the building than it was at my desk before. Let me see if I can get there a different way. All right, there we go. It just timed out, I think. Okay, let's try this again, and hopefully it'll connect this time. If it doesn't, I'll let that go. Let's go back to the slides while we wait for that. Couple things I wanted to tell you about. I've been mentioning that the next portal data refresh should be in April, and that would be data for July 18 through June of 2019. And that round will have reconsiderations open. We do reconsiderations every 6 months, and so we do it for 2 reporting periods at a time. So you'd be able to reconsider the data through, I think it would be April 2018 through June of 2019 at that point. This week, we are sending out a portal user survey. So you'll receive an email from me, if you haven't already, with a request to complete a SurveyMonkey survey for us. This is the first time that I'm aware of that we have surveyed portal users at all. We really want to understand how practices are using the portal, specifically the extent to which the data in the portal supports your quality improvement interventions. And even more specifically, if you've seen any measurable improvements in patient care or patient health outcomes based on data from the portal, we definitely want to know about that. So I'm estimating that the survey is at most 10 minutes, and 1 out of about every 30 participants will be randomly selected to receive a gift card from us. So please take a couple minutes to respond to that survey when you receive it. We will greatly appreciate it. The 2018 cost reports will be out in early March. For those of you who receive cost reports from us, those will be available to you. They're in the documentation section of the portal, and you'll receive an email when those are available. And we're planning to do a webinar about the cost reports as well. So I would expect that probably late March, early April, with a review of what's in the cost reports and how you might use them. And I wanted to mention that that my colleague Tori, who's here with me and monitoring the chat, is your new administrative contact for the portal. So any kind of user support, she has been managing for a little while, and you'll see most of these emails coming out from her going forward. So when you see an email from Tori Scholl, that's who you're hearing from. Okay, let's see if the portal's working yet. Nope. All right, so we're not going to add a new provider to the provider roster right now. We do have an email. Let's see what I want to do. I have some preset text that describes exactly how to add a provider, and maybe I'll just send that out to all users after this webinar, since I wasn't able to show it today. It's fairly simple. You enter the NPI, and then if the provider is already in our directory, you just click add. If they're not, you enter their information and click add. So it's pretty straightforward, but I'll make sure I send out that information. Back to the PowerPoint. I think that's it then. So, because I went ahead and did the rest of the PowerPoint, I think we're done. So let's open it up for questions now. Have there been any that came up in the chat? Nope. Okay. Please ask away, either by chat or verbally, your choice. Yeah. To unmute yourself, if you're on a phone, you'll need to press *6. The star and then the 6 button if you're calling in on a phone. If you're using your computer audio, you should be able to just unmute using the unmute control on your screen.
Hi there, this is Nona.
Hi, Nona.
Hi there. I have a question. When I am looking up to see if someone does have a numerator and I recognize it's probably specifically like one insurance plan, like with the A1Cs being done, should I report that? There's one plan where it's the A1Cs just have, I've just been having to manually submit that information in.
Right. Oh, interesting. Yeah, please do. And actually, I would say you can reconsider those individually, but if you're seeing a pattern of something incorrect like that, please email specifically and let us know, because that could indicate a data integrity issue.
Okay.
Yeah, so we would love to know about that. Thank you very much.
Okay.
And we've got a question in the chat. How do I get an eligibility list for CPC Plus members?
Oh, that's a great question. Let me see if the portal's going to work, and I can show you. So one place we can look for that, I might need to restart the portal. Let's pause on that question. I'm going to shut down the internet entirely. And try again. So just one moment, please. So I'm not able to log back into the portal. I don't know if you all are logged in. If you're all logged in, log out so I can get in. That shouldn't be an issue. I can't think of what is possibly going on right now, other than Murphy's Law. Oh my goodness. I'll try a different browser. Is it internet or is it just the portal?
I think it's just the portal.
It's just the portal. You're not able to get in either?
I would need to grab my device for two-factor authentication, which I'm happy to do. Sunita is also having trouble getting into the portal via Chrome or Edge.
Okay, those are the two I'm trying.
There could be a lot of people right there.
Yeah. So our partner from OnPoint Health Data, who is our data services vendor, is on, and it sounds like maybe it could be a problem of a lot of people in at the same time. So maybe if you are logged in, can you log out? If not, our question and answer period is going to be significantly shorter than it could have been. All right, I still can't get in. Let me try to verbally answer as best I can, and we'll just wing it for the rest of the time here. I'll turn on my camera. How's that? So you can see a list of your CPC Plus members under Patients. If you click on the Patients dashboard on the left side, in the filter you have the option of selecting CPC Plus members. So that should be available to you under Patients. It's also available in Measures. So if you're looking at the list of all the measures for your organization, you also have the option there of selecting just your CPC Plus eligible members, so you can see measure results just for your CPC Plus members there. Sorry, I can't show you. What other questions can you verbally answer without showing anybody?
I think the only other question I have is I had scrubbed through the latest list, and if I go in and invalidate those, will they like reconfigure the list of what I should be looking at? Will anything drop off, or will it be duplicated?
Do you mean your providers?
Just patients in general. So say that I know somebody had a hysterectomy and I have it ready to go to plug in the next time around. After those are recorded, when I do like an updated list, will those not be there, or will I still see those?
Oh, I see. Okay. Some reasons that you enter are forever exclusions. So if someone had a hysterectomy, for example, they would be forever excluded from the relevant measures there. Or a bilateral mastectomy would be a forever exclusion from the breast cancer screening measure. Others only apply to the specific reporting period that is of note. So I can't think of an example of those. Actually, Cindy, maybe you'd be a good one to chime in on this one.
Can you repeat the question, please?
Oh.
Yeah, the question was about differentiating forever exclusions on reconsiderations from not forever exclusions.
Okay, so basically it's done at the measure level. There are certain measures where forever exclusions make sense. For example, a hysterectomy for a cervical cancer screening, a mastectomy, double mastectomy for breast cancer screening. We're set up to allow those forever exclusions. There are other exclusions where we allow you to exclude for one measure round with the idea that the data that we have will get updated with the next measure round. And so we don't allow forever exclusions on there. The system is set up, it's very flexible. We're allowed to get in there and customize how we want it to work for each measure. So if you're running into a situation all the time where you think this person should be permanently excluded and there is a clinical justification for that, we can look at changing that so that you can add those exclusions in. As always, we don't take reconsiderations lightly, and so we need to, make sure that it doesn't get us away from the intent to the measure. Like I said, that there's a good clinical reason for it. And also, the other thing is being able to compare to benchmarks, that we're calculating the measure correctly. So.
Okay.
There was a question on the chat. What if there is a provider on the roster that was never affiliated with our organization? In that case, that must have been an error. So you don't have the option of just deleting that affiliation, but we do. So please go ahead and email us through the support email that's listed, that's available to you in in the portal there, and we can delete that affiliation so that it disappears off of all. Well, it won't disappear from all. It'll disappear from the current reporting period, but they won't appear anymore. Okay, and are there any other questions?
Hey, Lisa, this is Prasad Rabi from Kaiser Permanente. I had a quick question. I'm not sure if we submitted the OBGYN providers in our provider directory. Will you be able to check? I think we only submitted family medicine, family care, internal medicine, and peds, I think. I'm not sure. Can you check our provider directory or let me know? I mean, do we need to provide those? If so, like, is there a timeline on that? Or?
Do you know off the top of your head, Tori?
I don't know.
Okay, yeah, we can definitely double check that for you, Prasad.
Yeah.
There's no specific timeline. When we're able to update them, we would update them. Honestly, I can't remember what we did about KBs.
Okay.
Right. I was going to add one thing just for Prasad's benefit. So the OBGYNs have a slightly different attribution methodology. And so what we're doing is we're providing for clinics that have both 2 reports. So you would get a PCP report with your PCP measure results, and then you'd get a report for your OBGYNs for those results. And the members are attributed slightly differently.
Oh, okay. I see. Okay. Great. Thank you.
All right. Last call for questions. All right, very good. So we have a couple of months to figure out how to make the demo work when a lot of people want to watch it, so that it doesn't crash. And if you do think of questions after we get off the phone here, please go ahead and email us. We'd be happy to entertain them. Thank you all for your time, and we'll talk to you later.
Thank you.
Bye-bye.
Thank you.